Welcome to this massage tutorial. In this tutorial we will concentrate on the neck and back of our partner. I go to the head of my partner. From here I can effectively do these swimming movements. I slide now towards the shoulder next to the shoulder blade. I can do this on the left and right or on both sides, or crosswise. And we see again the body goes with the movement. So really remember this. Always use your whole body weight. Now I go with both fists next to the spine. My fists melt in the connective tissue and the so-called muscle fascia. The muscle fascia is the muscle enveloping and pervasive connective tissue. I do this movement across the joints. So I go up to her buttocks and do not stop earlier. This is very important, because muscles end always behind the joints. The connective tissue, called fascia trains, swipe the whole body, just like Chinese or Thai acupressure lines. Now I put her arms so on my thighs in that they cannot fall down. Her head is between my legs. The back is straight. The large back muscle, called the latissimus dorsi, is stretched slightly. The large back muscle is the largest muscle we have. In this stretch position, I do my swimming movements again. Now I have an advantage. Her forehead lays on the floor, so her cervical spine is relaxed. I can work here with very gentle movements, as if I would pet a kitten. I can also go into the so-called head joint muscles with the top of my fingers. Right here, behind the head and upper neck. These are the small muscles which do fine adjustments and make your head move. These muscles are often very tense. Now, I cross my fingers and my thumbs, and they go on the transverse processes of the cervical spine. Just like a pair of pliers, they give light pressure. I can also do circles. Here I am careful that I do not work too much, and that her breath is deep and relaxed. I can go between the spinners and transverse processes again. In order to be safe, I ask my partner to move her cervical spine herself, just like a small snake. I ask her to do little yes and no movements. She moves into the pressure herself, because if she had any injury, she would not want to make this move. That's why it makes sense to integrate active movements and self-motion. Now I can go over the muscle belly of the so-called trapezius and also on the underlying levator scapulae. The levator scapulae is the lifter of the shoulder, the scapula. Now I can draw a proper and deep line next to the spine. These techniques have a positive effect on distortions and adhesions in the connective tissue. I palpate, so I sense the tense locations with my other fingers. Then I draw this line another time. I slide really slow, almost melting down along this line. And here I go quietly back to the sacrum up and glide out towards the lateral buttocks. I'm touching her neck very gently, like I would stroke a kitten. A cat would, if it's too hard, immediately run away, or if it's not hard enough, it would also run away. But always think of these images. Move like animals would move. This way you will do a very effective and your partner will enjoy your treatment. Thank you for watching this video. If you liked the video and you want to see more, feel free to subscribe to my channel. If you have any questions or comments, just comment on the section below this video.